Today, we are talking with Krystyna Holland all about trauma-informed care and how that begins on your website. I am pumped. Welcome to the Up in My Business podcast with me, Lex Lancaster, where you'll get an inside look at all things tech, business, and my life as a physical therapist turned digital operations expert. You'll hear all about my lessons as a business owner, the ins and outs of tech for your business, and more. From SEO, websites, and email marketing to automations, launches, and copywriting, I've got you. I'm so excited you're here. Let's dive in. Before we start today's episode, I'd love to highlight our show sponsor, Jane. Jane app is a clinic management software and EMR designed to help practitioners grow and manage their clinics. They do this with the helpful features like online booking, scheduling, billing, and documentation, and they are the best, let me tell you. Whether you're working solo or in a large multidisciplinary clinic, no-shows and late cancellations are something that every practitioner faces, and they can be super frustrating. Jane offers several tools to help you prevent and manage those no-shows, including the ability to save a credit card on file and send out automated SMS and email reminders, and they are truly a game changer. Learn more about Jane's helpful features at jane.app/payments. Listeners can also include a code LEX1MO. Again, it's LEX1MO at the time of sign up for a 1-month grace period applied to your Jane account. Hello. Welcome back to another episode of Up in My Business. I am so excited today because I have a guest with me. I don't really do guest episodes often. And when this idea came to my head, I was like, I need to make this episode happen. So we have a guest, Krystyna Holland. If you are in the pelvic PT world, you are likely familiar with her. She's incredible. I'm going to let her do most of her introduction, of course, because I don't feel like I would be doing her a service by introducing her. I know she will do a much better job than I can. But Krystyna and I originally met way back when at a PT conference, I want to say in Orlando. No? Is it Orlando? Next conference?
Yes. Yep.
Yeah, next. So we had originally met at a PT conference and have stayed in touch since, and, is now a dear friend and someone that I text when, I need to talk about life things, every once in a while, and just someone that I like to check in with every once in a while. So I'm going to let her introduce herself to you. We're going to dive into all things trauma-informed care today and also whatever else comes about during the conversation. You know how we like to roll, just kind of going with the flow. So without further ado, this is Krystyna Holland. Welcome.
Hi. Thank you so much. We're also vacation friends. We have been on vacation together. We have technically traveled together. We know each other like that. But I'm Dr. Krystyna Holland. I'm a pelvic floor physical therapist. I use she, her pronouns, and I am the owner and founder of Inclusive Care, which is the name of my very small private practice here in the Denver metro area. In addition to owning my own practice and seeing patients, I also am involved in several different research projects, including a research project that is particularly relevant to this conversation today with a researcher, Dr. Lauren Walker out of Calgary. And so we have this really cool project where we're working with a whole multidisciplinary group of providers about trauma-informed care practices, whether they're doing them or not, why they are or not doing them, and trying to and also taking patient feedback from interviews and trying to make a very tangible list of trauma-informed care practices, because right now it feels very nebulous. I also have done some research in pelvic floor physical therapy related to vaginoplasty, so bottom surgery for trans women. And I wrote the playbook for painless sex, which I self-published and is available on my website for folks to use if they're not ready to see a pelvic floor PT.
So good. So good. We're going to link all of those things in the show notes as well. So if you're curious about anything, we will do that, as well as all of Krystyna's contact info. But I want to dive into, we'll talk about your practice shortly too, because I think that's important for people to hear. But for trauma-informed care, I originally had been talking with, I want to say it was a group of pelvic PTs, about how getting brand photography is intimidating. And folks oftentimes will say, I'm not sure I'm ready for it. I don't know how to get it. I don't know how to find someone. And I had this, revolution. I was like, but this is where being a trauma-informed care provider starts. So before we jump into all of that jazz, can you just dive into trauma-informed care? What it is,
totally.
what that means, all the things.
Yeah, it's definitely a buzzword right now. The way that I think of trauma-informed care is it's basically our ongoing intentionality of minimizing our risk of harming others. So what that means is that it identifies and we hold ourselves accountable to the fact that we can harm others. We can perpetuate harm and trauma and re-traumatization, even despite our best intentions. That we don't control. I mean, I don't even really control my nervous system. It totally controls me. So I definitely don't control anyone else's. And I don't know what other people have had in their past experiences that may be re-traumatizing or triggering. And that's something that I obviously think about in a clinical setting. But it does apply to, there's trauma-informed principles in teaching, in business, in even like hospital or other types of administration. It's basically all recognizing that we can do harm to others and being very intentional about not.
Got it. So if can you dive into a little bit more about the trauma piece? Because the word trauma, a lot of people that may be listening to this may be thinking, I'm not working with what we would call a sensitive population. And they be, thinking that they're removed from that situation. So I know that you just dove into it a little bit, but can you elaborate a little bit on that and how that's also applicable to anyone?
Yeah, totally. So it's not necessarily that every single person you see does have trauma, although the statistics are staggering in terms of the number of people, of adults in the United States who do have had negative childhood traumatic experiences. But also the reality is we all just went through this whole big group trauma globally that impacted us all differently based on like what our lives looked like, what, power and privilege we hold, stuff like that. But all of that to say that if you start thinking about any of the isms, racism, classism, sexism, fat phobia, ableism, any of those things like that are the things that are automatically things that could be traumatizing or re-traumatizing for an individual. So even if something that you say is not intended as an example, if you're working with someone who isn't white, and you're like, wow, your English is so good. And they're like, well, yeah, I was born in California, So even if your intention it's not bad, but that it could be interpreted that way. And you're not the only person who said that. For a closer to home example, I talk about genitals all day, every day. That's part of my clinical practice. So I have to be really clear about when I'm asking questions about sexual function. I work with a lot of trans and non-binary people. And I am very clear about why I'm asking the questions I'm asking and what is in it for the person who's answering the questions. So I'm not just asking for my curiosity. I'm not just asking like because I want to know, or because it's interesting. I'm asking because what you say about this will help me help you with this thing that you're interested in getting help with. So just recognizing that there are things, it's not that people are necessarily sensitive about, because the reality is that our nervous systems encode and kind of like hardwire all this information. So even people who are like very stoic on the outside can still have trauma responses that they are not even necessarily aware of.
Got it. I love that. And that's such a good description. And also just kind of highlights that what we do and making sure we're clear on why we're doing what we're doing is so important. And it goes, I feel like, most people listening to this, I'm not even sure if everyone has even heard the term before or even been taught anything about it. Mm-hmm. So if you had to give a resource, I know that you are an amazing resource, but something where someone can dive into, I'm going to say the initial steps.
Totally. So Substance Abuse and Mental Health Administration is the group that has really like put out a lot of the definitions and a lot of the information about trauma-informed care. What I appreciate about it, and we can link this in the show notes too, is, that information, I will be honest, it's dense and kind of boring, but they do have a document that talks about how trauma-informed care can kind of be applied and how these trauma-informed principles can be applied in other aspects, not just the actual provider to patient experience. And so I think sometimes that's helpful to start to open people's eyes to all the things that it can include.
Amazing. We will make sure we link that. Now, obviously, we're going to be talking about websites and whatnot, so why don't we just jump right in? if you are familiar with my line of work, I'm really focused on the tech side. So we're doing websites, we're doing photos, we're doing email marketing, what have you. One of the things that I find folks have a hard time with are photos. And, whether they don't love to take their own photos or they don't like being in photos as a provider, and they may not have someone to hire for photos, or it may be a costly investment. There are many things that can go into why we do not have photos on our website. So I've come to the conclusion here that I understand that there are so many barriers that we have. I think at this point, I would love to push anyone who does not have photos for their website to consider taking them with your iPhone. We already have these very expensive phones that take very good photos, and it's better than what I would consider nothing or stock photos. And when I was thinking about this, I was thinking about Krystyna, because I do feel like this is where we can show a potential patient, client, whatever you prefer to refer to your people as, who we are, what our place looks like, what does the parking situation look like, what do the doors look like, what do the rooms look like, are there private rooms? And I feel like this part, knowing that before you go somewhere, we can all attest that it makes us feel more comfortable. Now, I do feel like adding the whole, this can help someone understand, maybe you're not the provider for me because it looks a certain way, or you trigger me, like your physical presence can potentially trigger me. So Krystyna, do you want to dive into your, I'm going to say, thoughts, opinions, all the things on this topic? I want to hear everything.
Yeah, well, it's evolved over time, right? So I've been in practice 5 years. When I first started, I had nothing. I knew not at all what I was doing. I had my sister's best friend from high school, who was a graphic design student, design me a website, which I had for an extraordinarily long time. So let's just start there. And one of the things that, and so I want to say, one, I understand the concern about photos, because there are some like trauma-informed concerns around asking for patients' permission to put them in photos, like how you navigate that conversation, recognizing that you are their provider. So you are, regardless of the personal identities that you hold, in a position of power and privilege. So you want to make sure that people have the ability to say no very authentically, and that they can say yes very authentically as well. I also considered, like, okay, well, I am a cisgender white lady, and I don't only want to see other cisgender white ladies, but right now I'm seeing mostly cisgender white ladies. So then what do I do about that? How do I talk about it? How do I make it clear that people are welcome? I will say something that I absolutely have had on my brain for a million years, but haven't like actually done yet, is I want to do a whole video of like, here's where you park. And then I've actually taken the video. I just never did anything with it. That's small business ownership, entrepreneurship in a nutshell, is that you come up the stairs and you go into my office and like, look, this is where you can get yourself a drink. And then sending that. The nice thing is that not only can that information go on your website, it can also go in like your welcome emails to new patients, as an example. So that content is kind of the gift that keeps on giving. I say to myself as I'm going to have to take a new video because it was so long ago. I literally do not remember when it was. So that's a really good one. Another thing to just pay attention to is, and I want to talk about all of the things that patients will be looking for. So they're going to be looking for, do you have stairs or an elevator? So like if they have mobility concerns, when you go into the office, is it super sterile? Does it look super medical? Is it scary? Are all of the pictures on your walls of cisgender white people? Are they all really thin? Are they all really young? Are they all really beautiful? What books do you have on your bookshelf? What is the parking situation like? People will look and see, do you have chairs in your waiting room that their body will fit on? How big is your table? Will they be able to fit on that? If you have an elevator and they're in a wheelchair, is it going to be super terrible for them to navigate around your office? Or crutches or canes or any of the above. So those are, just like off the bat, a bunch of things that people will look for because they're things that are important to them.
Absolutely. That's so important. I feel like I have talked about this on my Instagram as well. I tell people directions are huge. right? So
Mm-hmm.
I have the first step of like, film yourself going into the parking lot and parking and showing where the door is, right? Because some
Mm-hmm.
people are like, where, if you're in a business park, sometimes it's very hard to find a spot.
Oh,
So
totally.
this, right? So it like really just dives into how can we make that even better? And exactly what you said, show going into the clinic, show your process, what have you. Now, with that being said, I want to go a step further. When it comes to website copy and what you're writing on your website, what would be a way for folks to, give others, give those who are looking at their services I want to say the best information, and setting the idea of like, we are open to seeing everyone. We see everyone. Or if they don't, right, then they
Mm-hmm.
delineate that in their website copy. What would
Yes.
you say are the things that you would require or think about?
Sorry, I got excited. Yeah, if you do not see people across the gender identity spectrum, if you only see cisgender women, so if you don't see men, if you only see, maybe you see trans women as well after vaginoplasty, so you only work with vulvas, it's the specificity that becomes really important because people need to know that you can see them. And it really sucks when people are calling around trying to get help and then they're told no. It's so much better to be able to look at your website and see like, oh, like this is a thing you actually can and will help me with. So yes, first and foremost, anytime that you're like, how could I make this a little bit more trauma informed? Make it a little more specific. Make it more specific, especially with like website stuff. Make it more specific and make it easier to understand. If you can do those two things, you're in great shape.
I love that. I love that. Now, I'm going to ask a question because I know that I have people who ask me. When we talk about SEO, when we talk about writing who we see, pronouns and identities become part of this. And
Mm-hmm.
folks will say, I am the provider for women in what have you. Can you
Mm-hmm.
talk on that, and what maybe is that problematic? Is there a better way to do it? Is that the way to do it if you're not seeing, trans women after androgenoplasty?
Yeah, totally. So a couple of things. One, here are some things that just are coming to mind. One, if you are seeing people across the gender identity spectrum, you don't need to put an X in women. You can just say women. That will, by definition, because trans women are women, if you just say women, it includes all women. So you don't need to specify that. And that's not what people are looking for. People are looking for other flags. So what I will tell you is that, like, as an example, if you say I treat pregnant and postpartum women, you're only going to get cisgender women. You'll put pictures of your ideal client, which will be women who are pregnant. And people will look at the website and be like, that's not me. So I don't even think I have pictures of people who are pregnant on my website, not because I don't see them, but because when people think of pelvic floor physical therapy, if they have any association at all, it's with pregnancy. So that is not something I'm like reinforcing with anything about my website. It's not the colors. It's not actually, let's talk about logos.
I
So
love
I
it.
got distracted. Can we move to that?
Yeah, I love when you get excited. So yes, go for it.
Okay. So
go off.
if you have not seen my logo, it is a series of diamonds of increasing size and in different colors going outward. You're more than welcome to look it up. Inclusive Care. It's the name of my company, and you can find me on Instagram with my name. But in any case, something that was really important to me is I wanted people to be able to see themselves represented in it. So I loved my initial logo. It was someone like a figure that had sort of like vague breasts. And then down at the bottom, it had like flames, or it kind of looked like hands. And it was all in a circle. It was very feminine. It was beautiful. I know you're not supposed to do this, but I totally paid a guy on Fiverr to make it for me. And it served me very well for a very long time. But trans masc people, men, and like cisgender men with, erectile dysfunction or something, are not looking at that and being like, yeah, that place, that's for me. That's where I'm going to go talk about my issues with maintaining an erection. Yep. So I worked on getting a new logo, shout out Kristen Mann. And we ultimately there was a whole conversation about how much these diamonds looked like a vulva. So initially, there's one dot at the bottom and there are like 9 dots at the top. Initially, it was that the bottom dot was at the top and the 9 dots were down at the bottom. But it looked to me like a clitoris at the top, which was 2 vulvar. Yep. So we just flipped it upside down. And so, I mean, it's giving sapphic. It's giving vulvas. If that's what you're looking for, if you are primed for knowing like what's up, you will find what you're looking for. What I love super like nerdily is that actually I would say it's a urogenital triangle, and it's both it's the urogenital triangle and the posterior one, and everyone has those. So gender neutral.
I love it. Gender neutral logo. That's great. I'm trying to remember your first logo. I don't remember off the top of my head, but like, let me pull something out. I can see Krystyna on video for those who are listening, but I'll put a link to her Instagram. Is your logo on your Instagram account right now?
Yeah. It
okay,
is.
Cool.
It's on. You can see it on my branding because now I have branding. It's like a whole thing.
It's the best, right? I love it.
I like your news stuff, by the way.
Oh, thank you. I appreciate that.
Yeah, it looks really good.
Thank you. I'm trying to think of where I wrote down some things. I do find, so I love what you said. I love what you said that specificity is important. If you have a second thought, be more specific, provide more information is really the overarching principle here. And if we're going to be writing website copy, be very specific. I do think, and I'm going to use some words that I've heard before. I feel like folks tiptoe the line of they're not sure if they should use the word women because they feel like that's going to not exclude people because they're trying to exclude people. They're not seeing people across the gender identity spectrum. And I'm not sure the reason that they ask this question, and I don't feel like I'm the person to provide the knowledge for this, but they ask because they don't want to be exclusive. But in the same hand, they don't want someone to come to them if they are not the best fit.
Totally. Yeah. So I mean, that's why we have
the
referrals.
Best way? Yeah. So say, is that the best way to do it? And if it's not, what would you recommend?
Yeah. So I want to be really clear that being the most trauma informed you can be is not being the most inclusive you can be if you can't back up that inclusivity with actual helpful skills. So if you don't have the skills to like provide those services, then you don't want to market that way. So it would actually be worse if you had a very gender neutral way of talking about everything and like made it seem like didn't necessarily talk specifically about women, didn't have pictures of pregnant and postpartum people. Like if you had my website, but then I was like, no, I only see cisgender women around pregnancy. That's way worse because people trust that I'm going to be able to help them, that I'm going to know how to help them. This doesn't say anything about intention. It doesn't say anything about your belief system. It's not just about like having it sound right or being nice or even really being inclusive. It's about being able to provide the services to the people who need them in a way that isn't likely or is less likely to re-traumatize them.
Love it. That is so good. That for anyone who has ever had that question, go back and re-listen to that. That was so, so good. Yes, 1000%. So if we dive a little bit deeper into being specific, such as with our photos, you mentioned that you do not have photos of pregnant women on your website. Now, you do provide care, correct, for pregnant and postpartum women.
Absolutely.
So for those folks that come into your clinic and they are pregnant postpartum, do they say anything specific as far as, I knew that you were for me, even though I didn't see myself? Is it the copy that you're using?
100%. Okay. I think it's between both the copy on my website and my Instagram presence. So I see lots of pregnant and postpartum women. I see lots of pregnant and postpartum straight white women. And they come in because we have shared values. So they're actually really excited to like come to my office and be seen here because it's in alignment with their values. They're voting with their dollar. Like they are supporting the businesses that support the things that they care about, which is amazing.
This is so good. That's great. I think people, because when you said that you don't show pregnant women on your website, I think some minds may say, but that means they'll never seek me out. So this is just going to show that not only are you talking to your ideal client as far as giving them the impression that you are for them on your website, you can do that in many ways, not just photos. So Krystyna has likely on her about page and on her homepage, she's probably talking about her values as a practice and as a provider. And then those are bringing people into her practice. So just going to say that it's important to share that stuff. What do you believe in? What is your practice? What are the values of your practice? What do you as a provider believe? And those people will seek you out. Oh my gosh, Krystyna. Oh my God. So cute.
Max just woke up from his nap and he's saying hello.
Give me kisses.
Yeah. So the thing is that I feel very grateful. So I just went through a rebrand last year and I had multiple people helping me with the rebrand. It wasn't just, I enlisted someone else's help for like brand strategy stuff because I know what I know, but it's hard for me to get out of my own head because I know that stuff, right? I can't just distance myself from my own nervous system, which is the thing I talk about in trauma-informed care trainings. Anyway, the point being that it is really helpful to have someone else's help and really talk about your values, especially if it's something, if you are working with or you want to work with a more vulnerable population, talking about your values first is super important. And if you are not, like, you still want to find the right people, right? We refer out all the time for all sorts of reasons. Yes. We talk very frequently in small business about how working with patients who are not your people will absolutely burn you out. You're trying to get to your people anyway. So, be yourself and show who that is and just be really clear.
100%. So if we gave people, a task list, because I'm always about here's the to-do. If you were to give people, let's just say up to 5 things to do on their website or to assess on their website to determine if they are, let's just say, starting to be in line with trauma-informed care on their website, what would those things be?
Just take a look and see what pictures are on your website. What are they showing? I will tell you that my website had a bunch of pictures of skinny women doing yoga at first. And that was not helpful because I don't even do yoga. I don't know anything about yoga. So from that perspective, making sure that your photos are showing something that's going to be helpful to people about your practice specifically, even if and actually I was going to say, even if it's not you, but I do believe that you need at least one photo of you on your website because I think something else that could be a possible problem with my website as an example is that sorry, Max is getting in the trash.
Totally okay.
I was like, what is happening? If patients saw my website and they saw me and they saw just a lot of pictures of people who were not white, but they were themselves a person of color and wanted a provider who could share that identity because of some like experiences of theirs, which makes a ton of sense. It would be not good for them to show up to my office and me be this sweet white pale color that I am. So I do think at the very least you need a headshot. Other things to look for is just look at your language. Look to see where you're using, whether it's pronouns or the other thing we haven't talked about yet. But of course we're going to is talking about sexual identity and who you're partnering with. I do think that that's something, especially if you work with cisgender women, but that you are someone who can work with and wants to work with lesbians, queer women, all of those sorts of categories, that being really clear about your language. I think there's a lot of stuff out there about husbands and boyfriends and yeah, go ahead.
No, just saying yes, that. Yes, you start to notice things.
Yeah. So I think partner, spouse, and that's a pretty easy thing. And that's the other thing is I would look at your, in addition to your website, your intake form. That's another thing that you can kind of audit. Another thing would be looking at, language. Oh, looking at who's represented. Like I mentioned, I, at the beginning, had a lot of the people who looked very similar to each other show up on my website because that's who I was comfortable asking. That's who volunteered. I feel lucky now that ultimately, just as a tip, the way that I handled kind of the asking people without asking people directly so they could tell me no if they wanted to or not tell me yes, is I put out a call on Instagram. And I am very lucky that I had a whole lot of different people help out, including Shantae. Actually, she didn't reach out to me. I directly reached out to her. So that would be another thing. One other thing is if I read on someone's website that they're a safe space, and particularly if they look like me, I immediately assume they are not. So I don't recommend putting safe space. I think it can do more harm than good. Because the only person who can decide if you were a safe person for them is your patient.
Love that. So what would be a better way to say that if that is your belief that you're trying to get that point across, what's a better way to do that? Is it showing them?
Yeah. I mean, show rather than tell, for sure. So
cool.
Things like, you can put like pride flags, and there are some stickers, or there are a gazillion. If you use Canva, there are a gazillion images you can use, like different icons that can communicate that you are an ally or that you see queer and trans people. Or
perfect.
Even if you don't see trans people, but you see people who aren't straight.
Perfect. I'm looking at Krystyna's screen. Okay, she froze for a second. We're good. I love all that advice. And I think it's a great way for everyone to take a step back. And even if you are, you're new, you don't have a website yet, you have a website, you can take a step back and say, okay, how can I audit my website, read through everything, make sure I have that, language that speaks to who I want to work with and who I am best for. And then lastly, I want to say, I think you said it earlier, referrals are important and referrals are huge. So where does one start with finding providers if they're not necessarily familiar with providers to refer to who do see folks across the gender identity spectrum?
Yeah, that's tough. So there aren't great, like robust options at this time. I will say if you're looking for a pelvic floor physical therapist, Pelvic Gurus directory, there does have a thing that will say if you work with trans people or not. Another thing, PT Proud exists. I will also say to any other queer physical therapists, PT Proud is a group, and a special interest group, and that's can be a great option. I think they might have a directory. Those would be, honestly, I think those of us, particularly if you're specifically working with queer and trans people, and that is who you're trying to work with, it is on our stuff. So if you Google it, you should be able to find it. Just for, I think, as an example, one of the things on my About page, it says, like, under our values, individualized, affirming, trauma-informed care. So already people are like, oh, okay, their brain's moving in the direction I wanted to. Then equitable and inclusive healthcare advocacy, which also already tells you. So at no point, there have been no photos of any people, but with equitable and inclusive healthcare advocacy, that already flags to people any of those, like, that I'm thinking about any of the isms, that I'm being intentional about identity pieces.
I love it. So good. So good. Before we wrap up, is there anything that you want to say? I'm just thinking, like, go off, Krystyna. Is there anything that you have on your mind that you feel would be important for anyone to know, that if they're treating humans, if they work with humans daily, that is just important to consider? Websites, totally. Photos, regardless, anything.
So being who you are is super important. And I think if you're listening to this and you're thinking, I don't see any of those people that you just named, except for maybe white, cisgender, straight, pregnant women, I would take a moment to consider why that is. If that's because you don't want to, or maybe your marketing isn't clear about that, or that maybe you don't feel like you have the tools to be able to work with trans and non-binary people, as an example. And I want to say, just get clear with yourself about if that's true. Definitely don't market or advertise to people who are vulnerable that you do not feel like you can safely treat. What I will also say is you can treat them, like you have the knowledge to be able to help them. You just have to decide if you feel competent in some of the identity pieces. And if you're not, I would really challenge you. I used to just say, like, that's totally fine. Everyone gets to have their own boundaries. And that is still true. And also the healthcare system and the system around people's rights in the United States right now is very scary. And a lot of people do not have access or will not have access. And they're not going to care if you misgender them if they can't get life-saving treatment, or if it's illegal for them to be treated. So all that to say, I think now is a really good time that if you're not feeling confident in those skills, but you're like, yes, heck yes, I would love to see people like that. Also, again, I think feels a little hands made taily, but as things continue to go in the direction they're currently going, telehealth and more like virtual stuff is going to come up for these populations, because that's going to be the way they can ensure their own safety. And so now is a good time to start getting those skills, working on those skills, if that's something that you are open to, but do not currently feel confident in.
Amazing. And you mentioned a resource earlier. Remind me what it was called that we're going to link about trauma-informed care.
Oh, the Substance Abuse and Mental Health Administration's website. And there's also, so there's actually a group of 2 occupational therapists, pelvic health therapists, who are doing a trauma-informed care certification. I did some teaching with them, and we'll link that too. I can't remember the name of the program off the top of my head.
That's amazing. That's so good. I love it. Well, this has been great. I think I'm really excited because there are so many tidbits in here that I didn't have the answers to, and people ask me things, and I feel like this will be a great place to say, hey, go listen to Krystyna, because she lays everything out very clearly. And the biggest summary that I feel like people can walk away with, if you take anything away from this, to me, I am hearing Krystyna say, be specific and make sure you are very descriptive. And if you have a second thought, make sure you add in more. Like, just be descriptive and be upfront and be yourself, and make sure you share your values, and your people will find you. And also, you can start practicing in a way that will be more trauma informed. I don't think that this is the only way. We need to do way more. It's not just about your website, but this is a great starter for that online aspect.
And the nice thing about all that specificity, sorry, I got excited again.
No, go. I love it. You can do it. Go off.
The thing about all of that specificity is it's also good for SEO, right? So it really is, it all contributes to the same thing. You're getting the people who you will like to treat. They are more likely to find you because of your SEO. And you are differentiating yourself by talking about what you care about and who you are for. And I think if we remember that, it lends itself very well. And just in general, if we just think about the fact that our actions and our words and our inactions can actually do pretty significant harm to people in our life, even when we absolutely do not intend to, particularly as people in medicine and medical providers, and trying to mitigate as much as possible, you're doing a great job.
Boom. I love it. Thank you so much. Where can people find you?
Yeah, so the best place is Instagram. It's my first last name, Krystyna.Holland, on Instagram. And especially if you're interested in any of this stuff, I'm actually, especially because June is Pride Month, and that is when the gays do their thing. So I will be doing some sort of training for sure. And I'm in the process of getting all of what I've done for my intake paperwork, getting it together and basically packaging it so people can just purchase it. You can download it and then you have that. And so all that stuff is coming. So all that to say, Instagram, and then everything will be from there. And actually the link in my bio in Instagram has tons of stuff in it.
So good. Thank you so much. Everyone, make sure you go check out Krystyna, follow her, see what she has to offer. She has all the things, and keep your eyes peeled for all the stuff to come down the pipeline. This is so exciting. Thank you so much, Krystyna, for coming on. I truly appreciate you. This was a blast. And
I'm so glad we did it.
I'm so glad. I'm so glad you did it. And thank you so much, everyone, for listening. Please let me know, as always, if you have any questions. You can feel free to reach out to me. Krystyna, is it okay to DM you on Instagram if they have questions from this episode?
Please do. Okay, amazing. Please DM me and tell me that you listen to this podcast.
Perfect. Thank you so much. I appreciate you. Thank you so much for listening. I will catch you next time.